Matthew Mukash's family documented his stay at the Montreal General Hospital's ER. Like many people from northern communities, the former Grand Chief of the Council of the Crees was flown to the city for medical exams. When the first results came in, he was told he had to be admitted.
And that's when the whole ordeal started.
His granddaughter was with them every step of the way.
They told us that he would be temporarily being moved to out of the examination room, and that's where he was left in the ER lobby, and he wasn't moved after that until he was discharged 4 days later.
Mukash says her 72-year-old grandfather was then sent to a hotel. There were no rooms available for him at the hospital.
Each time I ended up there, I was in the hallway for a couple of days myself.
To the chairman of the Cree Board of Health, this is nothing new. He says patients, including himself, get flown out of the community on a regular basis.
It's one of our biggest costs, I think, in the organization. And it could be simple things. Sometimes CT scan, which we don't have in the area.
In an email to CBC News, a spokesperson for Quebec's Minister of Indigenous Affairs says Dion Lafrenière is very concerned about what happened to the former chief. He says health facilities need to adapt to be culturally safe for First Nations patients. It's something Mukash says needs a lot of improvement.
Being in the emergency room, I did see a lot of Indigenous Inuit population come in, and it is confusing, to be sent so far away from home where you only have, small clinics. And then to be sent to these places where, they might not speak English or French.
The Montreal General Hospital says there's been a record number of patients occupying their ER beds as they wait to be transferred elsewhere in the network. Staff shortages are also causing ERs across the province to overflow.